So you've just been told you need a lumbar fusion. I know that's a lot to take in. Your mind is probably just racing. It's a recommendation that carries so much weight and, let's be honest, a whole lot of fear. So today, we're going to cut right through all of that noise. We're going to separate the fear from the actual surgical facts. Right. The doctor says those words, lumbar fusion. And what's the first thing most of us do? We immediately turn to the internet to try and figure out what this is really going to mean for our lives. And what you find there, usually, late at night when you can't sleep, can be absolutely terrifying. I see these posts, I hear these exact same fears from patients in my office every single day. You're trying to make this huge, life-altering decision, and the internet just feels like it's screaming every possible worst-case scenario right at you. Okay, let's dive into this because this right here, this is the single most important idea to get your head around. The fusion you're reading about in all those horror stories is very often a completely different surgery from the one you're likely being recommended today. Look at the difference here. This is so important. On the left, that's what's fueling all the fear online. These huge, complex, multi-level fusions. They're done with older, open techniques that mean cutting right through major muscles, which leads to more blood loss and those really long, really painful recoveries you read about. But look at the right. That is the reality for the patients we treat here at Vertrae. It's a single-level, minimally invasive surgery that spares the muscle. We use robotic precision for sub-millimeter accuracy. The recovery, it's just in a completely different universe. So let's just tackle your biggest fears head-on. Not with some vague reassurance, but with the actual data for the specific surgery we're talking about. This is a huge one. I get it. It really comes down to trust, right? Can you trust this hardware that's inside your own body when you can't see it, you can't feel it? Well, this is our answer. At Vertrae, we use MIS robotic guidance for every single fusion we do. And with it, we achieve an accuracy rate of over 98%. Think about that. Before we even make a single incision, we have already planned the exact, perfect trajectory of every screw on a 3D model of your spine. And this chart, this shows you what that precision actually means for you. It means a dramatically lower chance that something goes wrong and you'll need another surgery. With robotic assistance, the rate of needing a second or a revision surgery is roughly 1/5 of what it is with the older freehand techniques. It just makes a massive difference. Now, this is a really smart question that I often get from patients who have done their homework. They've read that if you fuse one level of the spine, it can wear out the levels right next to it. And you know what? The numbers they see online are real, but they're almost always missing some crucial context. Here's the context that gets lost. For a single-level, minimally invasive fusion like we're talking about, the rate of developing adjacent segment disease that actually causes symptoms and requires another surgery is less than 5%. It's just a fraction of the risk that's associated with those bigger, multi-level open fusions that skew all the numbers you find online. And this helps explain why the internet feels so overwhelmingly negative. It's something called survivorship bias. Think about it. Patients who have a great result, they get back to their lives. They're out golfing, they're playing with their grandkids, they're back at work. They stop posting on spine forums. The people who are left, the ones who are still posting, are disproportionately those who are still struggling. And that creates this really skewed, scary picture of what the actual success rates are. Okay, so let's talk about what all this means for your recovery, because most patients are picturing the kind of recovery their uncle or their neighbor had 15 years ago. But the reality of a modern, minimally invasive fusion is just fundamentally different. Just look at this comparison. The published data, the averages, show patients getting off narcotics in about 10 days and driving in 21. At Vertrae, our protocol is designed to get you there in 7 days for both. Now, that's a very deliberate choice. We get you moving and independent really quickly. But then notice, we're actually more conservative on returning to work. That's also deliberate. We prioritize protecting that fusion while it heals over rushing you back to a desk. Getting patients off of narcotic pain medication within a week, that's a huge goal for us. It's one of the best indicators of just how much less traumatic this surgery is compared to the old open techniques. In fact, we're actively working toward a completely narcotic-free protocol, which would just be a massive step forward for patient recovery. And just think about what this means for your life. Driving in 7 days isn't just a clinical milestone, it's you regaining your independence. It's the freedom to run your own errands, to go see friends, to feel like yourself again. It's a huge psychological boost, and it happens so much faster than most people ever expect. But here's the bottom line. What does it all add up to? It's not just about a faster recovery, it's about an effective one. 80% of our patients report meaningful, tangible improvement in their lives within just 3 months. The goal is to get you better, and the data shows that for the right patient, this surgery really works. But, the surgery itself, the technical part of it, that's only one part of the equation. What happens before we even step foot into the operating room is in many ways just as important. This is a truly stunning statistic. After a technically perfect fusion, nearly 2/3 of patients develop a clinical fear of movement. So the spine is fixed, the imaging looks great, but they are terrified to trust their own body. That fear can sabotage a perfect surgical result. And that's why this research is so profound. It found that the single biggest thing that predicts whether a patient is happy with their surgery, it's not how much their pain improved, it's whether the outcome matched the expectations we set together before the surgery even happened. And this means that the pre-surgical conversation, it isn't just a formality. It's actually part of the treatment itself. Taking the time to align on what success looks like, what the recovery will really be like, and answering every single question you have, that is the most critical part of this entire process. So I really want to empower you with the questions you should be asking any surgeon you talk to. Number 1, can they offer you other options, or is surgery their only tool? 2, do you really understand what a successful outcome looks like for your specific situation? 3, have they clearly explained why those other options aren't the right fit for you? And maybe most importantly, 4, do you feel like you've truly been heard and understood? If the answer isn't a clear yes to all 4 of those, you should keep looking. And this slide really shows why that first question is so vital. At Vertrae, our motion-first philosophy means we have the full spectrum of options, from non-surgical therapies all the way to surgery. This makes sure that when we do recommend a fusion, it's not because it's the only tool I have in my toolbox, but because it is genuinely the best solution for your specific problem after we've considered all the other paths. And that recommendation, it comes directly from me. Every single new patient at Vertrae gets a personal evaluation to make absolutely sure we're choosing the right path forward together, right from the very beginning. So I'll just leave you with this final thought. A fusion recommendation can start as a moment of fear, but it does not have to stay that way. When you are armed with the right information and you're asking the right questions, you can move from a place of fear to a place of real confidence in your decision. If you'd like to learn a little more about the approach we've talked about today, you can visit us at vertrae.com.